If you've ever searched for hair plant, you're not alone. Many people hear this term and wonder if doctors are actually planting something new on your head. The idea of getting your hair back sounds simple, but in reality, it's more complex than it first seems. Hair transplants can offer hope, but they also come with questions, risks, and confusion. Around the world, more people are considering hair transplants than ever before. Social media is filled with before and after photos, celebrity stories, and flashy clinic ads. But glossy pictures rarely show the full story. Underneath the surface, there are important decisions to make and risks to understand. Before you book a flight or choose a clinic, it's vital to know what a hair transplant truly involves. It's not just about growing hair, it's about surgery, science, and careful planning. If you want to avoid disappointment, or worse, serious health problems, you need to be informed. This essay will break down the facts about hair transplants. We'll look closely at the science, side effects, rare dangers, and, most importantly, how to decide if it's right for you. Let's clear up the confusion, step by step. A hair transplant is a type of surgery that moves hair from one part of your scalp to another. Doctors take healthy hair from a donor area, usually the back or side of your head, and put it in the area where hair is thinning or gone. The aim is for the new hair to grow naturally in its new spot. Think of it like moving a patch of grass from a healthy part of your lawn to a bare patch. The grass, or hair, roots itself and, with luck and care, starts to grow again. The process does not create new hair. It simply redistributes what you still have. Hair transplants are not only for baldness. They can also help people who have lost hair because of injuries or certain illnesses. Both men and women can get hair transplants, although men are more common patients because of male pattern baldness. The two main ways to do a transplant are called FUE and FUT. Each method has its own pros and cons. Understanding the difference can help you ask the right questions if you're thinking about surgery. The first method is follicular unit extraction, or FUE. In FUE, the doctor removes tiny, individual hair follicles from the back or sides of your scalp. These follicles are then placed one by one into tiny holes where new hair is needed. The process takes time, but it leaves only small, dot-like scars that are hard to see. The second method is follicular unit transplantation, or FUT, sometimes called the strip method. Here, the doctor takes a thin strip of skin with healthy hair from the donor area. The strip is divided into small grafts, and each graft is implanted in the bald area. FUT leaves a longer, linear scar where the strip was removed. FUE is more popular today because it's less invasive and doesn't leave a big scar. It's a good choice for people who want to wear their hair short. FUT can be faster and may be better for people who need to transplant a large number of hairs. Some clinics still prefer FUT in special cases. Both methods use local anesthesia, which means you're awake but don't feel pain in the area being worked on. Recovery time varies, but most people can go back to work within a week. Most scientific studies show that hair transplants are generally safe and effective when done by qualified doctors. Success rates are high. Often around 85 to 95% of transplanted hairs survive and grow in their new location. Results look natural with modern techniques, and people who follow aftercare instructions do well. A review published in the Journal of Cutaneous and Aesthetic Surgery in 2023 found that both FUE and FUT give reliable results. The key difference is mostly in scarring and the size of the area treated. The review also stressed that patient selection and surgeon skill are crucial for good outcomes. Problems usually arise in low-quality clinics, where staff may not be properly trained. Unclean facilities increase the chance of infection or poor growth. Sometimes clinics use aggressive advertising, but cut corners on safety. This leads to bad results and unhappy patients. In the right hands, serious complications are rare. Most people are satisfied with their hair transplant if they do research and choose a reputable clinic. Still, it's important to know that no surgery is risk-free. Like any surgery, hair transplants come with side effects. The most common ones are, honestly, pretty mild and temporary. After the procedure, you might notice swelling on your forehead or scalp, redness, tiny scabs, and itchiness are also normal in the first week or two. Some people experience what's called shock loss, where old hairs fall out shortly after the transplant. This can be scary, but it's usually temporary. New hair starts to grow in the next few months. Mild pain or numbness in the donor and recipient areas is also common, but fades with time. You might see small pimples or ingrown hairs as follicles settle in. These can be treated with simple care and usually don't cause lasting problems. A little bleeding or crusting is also expected during early healing, but if you notice pus, severe pain, or spreading redness, it could mean infection. This is not normal, and you should see your doctor right away. Most side effects are mild if you follow the clinic's aftercare advice. Serious diseases from hair transplants are, honestly, very rare, especially in clean and well-run clinics. The biggest risks actually come from places with poor hygiene or unqualified staff. Infection is the most common danger, but it's usually treatable with antibiotics if it's caught early. In some rare cases, deep skin infections called abscesses can form. Even more rarely, blood-borne viruses like hepatitis or HIV could be spread if dirty tools are used, but this is extremely unlikely in modern, certified clinics that follow strict rules. Other rare risks include severe scarring, known as keloids, long-lasting numbness, or even hair growing in the wrong direction. Allergic reactions to anesthesia can happen, but these are very uncommon. The bottom line is that these risks are nearly always avoidable. That's why your choice of doctor and clinic matters so much. Always check credentials and ask about safety measures before you decide. Hair transplants are not for everyone. Good candidates are generally healthy adults with stable hair loss. If you have enough healthy hair at the back or sides, it can be moved to the thinning area. Your scalp should be free from untreated skin diseases or infections. People with certain medical conditions, like uncontrolled diabetes or blood clotting problems, should avoid surgery until their health improves. If you are too young, say under 25, your hair loss might not be stable, and in these cases, waiting is often better. Women can also have hair transplants, but results can vary more than with men. Some types of hair loss, such as diffuse thinning, are harder to treat with surgery. People with unrealistic expectations should also think twice. A transplant won't give you a teenager's hairline. The best way to know if you're a candidate is a face-to-face consultation with a professional. They can check your scalp, discuss your goals, and help you decide if now is the right time. The first and most important step is choosing a qualified doctor. Look for a surgeon with experience, good reviews, and up-to-date training. Ask to see before and after photos of their real patients, not just advertisements. Don't be afraid to ask questions about safety and hygiene. A clean clinic is a must. Make sure all equipment is sterilized, and staff follow proper infection control. You can usually spot a quality clinic by how they answer your questions and explain the risks. Avoid places that rush you or offer too good to be true deals. After surgery, follow every aftercare instruction carefully. This will help your scalp heal and reduce the risk of infection or poor results. Wash your hands before touching your scalp and avoid scratching or picking at scabs. Finally, be patient. It can take 6 to 12 months to see the full results. New hair grows slowly, so don't judge the outcome too early or panic if you lose some hair in the first weeks. Good things take time. Hair transplants can honestly change lives for the right person. For many, they restore not just hair, but confidence. But it's important to remember, a transplant is not a miracle cure. It works best when you have realistic goals and understand both the science and the limits. Having the right doctor, a clean clinic, and careful aftercare are more important than chasing the cheapest deal. The process is slow and requires patience. Results vary from person to person, and a perfect movie star hairline is rare. If you're thinking about a hair transplant, see a qualified professional first. They can explain your options, risks, and chances of success. Don't rush into surgery because of advertising or social media hype. In the end, a hair transplant is just one tool, not a magic fix. With the right preparation and honest advice, it can be a safe and satisfying choice. Make sure you know the facts before you decide.